Hello guys, I'm Dr.RAYLEE. Welcome to my channel. Today we're going to talk about a really important topic. It is about men's health or men's reproductive system. Basically, we are talking about the difference between sperm and semen. Okay, so the title of this discussion is Sperm versus Semen, the truth no one told you. And if you're joining me now, good morning, good afternoon, good evening, wherever you are watching this live video from. Then my name is Dr.RAYLEE. This is the Consult Dr.RAYLEE channel. We talk about all that is related to health, including reproductive health for both men and women. Tonight, our main topic is about men's health, specifically the difference between semen and then sperm. I'm going to tell you why this matters so much. Okay. Now, most people, think sperm and semen are the same thing. Okay, and that is because they are usually mostly interchangeably used. And when I was growing up, I used this anytime I'm using the word sperm or semen, I use them both interchangeably. But what if I told you that they are completely different? In fact, you could have semen with zero sperm in it and not even know it as a man. So if you're a female watching this video, a woman watching this video, please share this video with your husband, your partner, your brothers, your fathers as well. To really help them understand better. And I'm going to tell why this is super important, why it matters to listen to what I'm about to share with you. Now, so today I'm breaking down the real differences between sperm and semen, how it works, and what it means for your fertility, for your health, and for your future. So if you are married and you're a woman watching this video, this is also for you. So just don't think it's just for men, for you as well. If you are planning to get, have a child or children, it's very important. So, and therefore, if you care about your health as a woman, as a man, most importantly, if you care about your body and your future family, this is one video you don't want to skip at all. And so by the end of this video, you understand what sperm actually is, what semen really means and contains, the key differences most people misunderstand, and what affects sperm quality and fertility. Again, welcome to my channel. If you have any contributions, any questions, any experiences, solutions, please share in the comment section below, and we'll be glad to answer your questions and also learn from your experiences as well. So let's dive right deep into it. We're going to start with sperm. What is sperm? Now, sperm is a microscopic male reproductive cell. What that means is it is something you cannot see with your optical eyes. You can only see it under a microscope. So when you see an ejaculate in a test tube or that container, when you go to do your semen analysis test, okay, for example, what you are seeing with your physical eyes, optical eyes, is not sperm, okay, because sperms are not, you cannot see with them with your eyes, okay. It can only be seen under the microscope, and that is why it is called a microscopic male reproductive cell. And its only one job is simple but powerful: to fertilize a female egg for pregnancy to take place. Okay, so that is the job of a sperm, to meet an egg so that pregnancy can occur in the womb of a woman. And each sperm, cell has three main parts. Okay, so when you are seeing the sperm under the microscope, it has three major parts. Okay, we have the head, and the head contains what we call the DNA. That is your genetic information. So as a man, when you release sperm into a woman's, cervix, into the womb, okay, the head of that sperm, when you're looking under the microscope, is what contains your DNA, your genetic information that is passed on to your child. Okay, so that's where that genetic code is coming from. It is part of the head of that sperm. And then we have the mid section or the midpiece that contains or packed with energy, that is your mitochondria for proper propelling to meet the egg. And then we have the tail. Okay, the tail also helps the sperm swim toward the egg. So these three parts, the head, the midpiece, and the tail, all together make sure that your sperm meets an egg and the fertilization takes place. And then when a child is born, the child has your genetic code as the man. Okay, and now here's something interesting that most people don't know. A single ejaculation can contain millions of sperm cells, but only one is needed to fertilize an egg. So that is, if you do your semen analysis, for example, you could have millions of sperm in that test, okay? But it is only one of them that is needed to fertilize an egg, and that is really interesting. So that small bottle that you see when you see your ejaculate contains millions of sperm. That is why you cannot see it with the optical eye. It has to be seen under the microscope. And then once we count it, it's about millions of them, okay, in that particular ejaculate. And only one sperm is needed to fertilize an egg. And this is the beauty of nature. And not all sperms are equal, okay? I'm going to talk about that. Some are very slow, some are abnormal, and only the strongest survive the journey. So once you release these millions of sperm into the woman's womb, there's only one that quickly gets, fertilized the egg, and it depends on how strong they are, how quick they are. So that is what a sperm is all about. Now let's talk about semen, because we are talking about sperm and semen, the differences. Okay, with semen, it is the fluid that carries the sperm. So think of it this way: if sperm are the passengers, semen is the vehicle. So when you see, passengers in a car, those inside the car or the vehicle is what we term as the sperm, and the structure or the vehicle is the semen. So when a man ejaculates, for example, what he sees with the optical eyes is the semen. What the woman sees when some is dripping out of the cervix throughout the vagina and out of the body is called the semen. Okay, the semen is something visible, but the sperm can only be seen under the microscope, and the semen is that fluid that you see. Okay, and semen is made up of fluids from several glands. We have the seminal vesicles, we have the prostate gland, and we have what we call the bulbar urethra gland. So these three are what are responsible for producing semen, or the makeup of semen. Now here is the shocking part. Sperm make up only about 1 to 5% of semen. This is very interesting, which means that when a man ejaculates and you see the semen in that test tube or that bottle, there's only 1 to 5% of that make up the sperm. And even that, you cannot even see the sperm. The rest is fluid. And the fluid is a mixture of water, proteins, enzymes, and fructose. Fructose is a sugar that gives sperm energy. Remember the mid piece of the sperm, that is a mitochondria. So fructose is what energizes that mitochondria to help propel the sperm to meet the egg for fertilization. So when you see semen, what you are mostly seeing is not a sperm. Okay, it is that fluid you are seeing. It is that optical fluid you are seeing with your optical eyes, and the sperm usually is unseen. It can only be seen under the microscope. So that is the difference between the sperm and the semen. So now to break them down, the key differences in terms of definition is that a sperm is a reproductive cell. Okay, a semen is actually the fluid that carries the sperm. And in terms of function, the sperm fertilizes an egg for pregnancy to take place, for conception to take place, and the semen protects and nourishes the sperm. Okay, and in terms of visibility, again, the sperm can only be seen under the microscope. That's why it's called a microscopic reproductive cell. You can't see with your optical eyes or your physical eyes. But with semen, it is visible, okay, to everybody. Once you ejaculate, we can actually see that this is actually a semen, but with sperm, we cannot see it. So that is the key difference between semen and sperm when it comes to the visibility. And then when it comes to the fertility factor, which is the most important of them all, which that's why this video matters a lot, you can have semen without sperm. This is very important. You can have semen without sperm. In other words, you can have an ejaculate. You can see that you've ejaculated as a man, and still there will be no sperm inside that ejaculate. Remember, the sperm is only 1 to 5% of the makeup of the semen. The rest is fluids. Okay, so you can actually have sperm or semen without sperm inside, and that is not normal, and it's called a condition called azoospermia. Okay, This is why some men may appear normal but still struggle with fertility. And this is why this really matters a lot. I have seen a lot of patients, most of the men, who get very confused, and they have this misconception that saying they can ejaculate, have erection as a man, it means they are fertile, and that is absolutely not true. So in other words, erectile function does not equal fertility. Ejaculation does not equal potency. So the fact that you can ejaculate as a man, the fact that you can have a very good sustained erection as a man, the fact that you can release semen doesn't mean that you are potent. Doesn't mean that you have the ability to father a child. Okay? And that is why I'm saying that you can have semen without sperm, and that is called azoospermia. And there are other disorders of semen quality or sperm quality, and we're going to talk about that as well. And so you might ask, what are the causes of these things? So what could make a man produce semen all right but without no sperm, and that affects fertility or delays fertility? Number one would be hormonal imbalances. Okay, that's number one. Okay, remember, the dominant male hormone of a man is called testosterone. We have other ones like estrogen and even progesterone. All of these things help, but the dominant one is testosterone. So if you have lower testosterone, it can affect your fertility as a man. Though you might have a very good erection and also have a lot of ejaculate, it doesn't mean that you can father a child until you look at the quality of your sperm. And then the other cause could be what we call blockage in the reproductive tract. So sometimes an infection can cause that, sometimes even injury can cause that. So you can have all of those things having, you can produce sperm all right, but the sperm will not be enough as well. And then we have genetic conditions as well, and that can also predispose you to having what we call azoospermia. That is no sperm counts in the semen, or some other disorders like oligospermia, or which also means low sperm count. Okay. We have azoospermia, which means no sperm inside the semen. We have oligospermia, which means lesser sperm in the semen. So all of these are some of the disorders of male reproductive health. Okay, and then we have testicular damage. When your testicles are damaged, it can also affect the production of the sperm as well. Though you might produce semen, but there will be less or no sperm in that semen. This is why a semen test is crucial if you are trying to conceive, because appearance alone tells you nothing. Okay, we need to go further to do other tests as well. Now let's look at what affects sperm quality. Okay, this will be one of the crucial things as a man you need to know, or as a couple you need to know. Now, research shows that sperm quality depends on, number one, most importantly, diet. So that, which means that low nutrient equals poor sperm health. So if you are not eating well as a man, that can affect the quality of the sperm. So you might have less sperms inside the semen, or even no sperms at all. You can even have enough of it, but they are abnormal as well. Okay, remember we talked about the slow sperms, the abnormal sperms, the sluggish sperms, and even the faster ones. So you can have a lot of sperms, all right, but they are very abnormal. Okay, so that is what affects your sperm quality, and that is why important nutrient like zinc matters a lot. Vitamin C, which an also matters a lot, and then vitamin D also matters a lot, and even the omega-3 fatty acids. Now, one of the food that has the highest amount of zinc is oysters. I think zinc is one of the most, if not the most important, but one of the most important nutrients for all men. Okay, in terms of boosting their testosterone levels and also for fertility. Okay, and then we have vitamin C in the citrus fruit. We have vitamin D in the cod liver oil, the fatty fish, and other nuts and seeds, and the omega-3 fatty acids. Okay, so the first one that affects your sperm quality will be diet. Okay, the second one will be heat. Excess heat can reduce sperm count. So things like tight underwear, putting your laptops on your lap, and taking hot baths frequently can also affect the environment of your testicles. Remember, the testicles are involved in the production of semen and sperm. And so if there's a lot of heat around that area, they affect the quality of your sperm as well. So if you're in the habit of wearing tight underwear almost all throughout the day, that's not a good thing at all. let your testicles and your pelvic area have a lot of aeration, okay, as a man. It's super important. And then avoid putting laptops on your lap because of that heat that it generates, and also affect the environment there and affect the sperm quality. And then we have lifestyle activity like smoking and alcohol. These two are heavy contributors of affecting your sperm count negative or the sperm quality negative. And things like lack of sleep. Now remember that you produce more testosterone, the more sleep you have, the better sleep you have. That is okay. And so you're having less sleep as you should. It's going to affect your hormones and cause hormonal imbalance, which is going to trigger low sperm count in the near future or eventually. And then stress as well can also cause that. So all of this reduce your sperm quality. And then we have environmental toxins like pesticides in our foods and waters, heavy metals in our food and waters, pollution all around us. These can damage the sperm DNA and affect the sperm quality. And then one thing that most people don't really talk about is what we call the frequency of ejaculation. That is, too frequent or too infrequent ejaculation can affect sperm concentration. And that is why balance matters a lot. Let me explain this particular part. You see, it takes days and weeks for a new set of sperms to be produced as a man. And so if you are always having sexual intercourse and ejaculating often, maybe the first ejaculate could contain, quality sperms, okay? But the excess or the one that follow from after can, the quality will reduce. So if you are always having sexual intercourse, doing a lot of, you are masturbating too frequently, all of these things, if you are doing them a lot, know that it can affect your chance of getting pregnant, okay? Because your body has to rest and produce quality sperm count. So that's why too frequent ejaculation can also affect that. And then if you're not even doing that at all, that can also, affect your rate of getting pregnant. Because remember, the sperm also has a duration, what we call an expiring date. Okay, so if you're not having sex at all or sexual intercourse at all, then your chance of getting pregnant also drops. So balance matters a lot. Now let's look at what the research says about sperm. According to the World Health Organization, healthy sperm concentration should be at least 15 million sperm per milliliter. This is very interesting. And a study published in the Human Reproduction Update found that sperm count have declined significantly over the past decades. So when you ejaculate as a man, that thing you are looking at, that semen should contain at least 15 million sperm per milliliter. That increases your chance of getting pregnant. So there are men who have lesser than that, have more than that as well. And even those who have more than that, sometimes the quality also matters a lot. So it's not only about the count, the quality matters a lot. So you can have someone with lesser, let's say 10 million sperm per milliliter, and still be able to get pregnant or make a woman pregnant, and someone who have 15 or more and still not be able to get a woman pregnant. That's because the quality matters a lot, okay? You can have a lot, millions of them, but the quality is what eventually matters a lot. So it is both sides, the count, the number, and the quality is what we are looking for. And like I said, the sperm count or quality have reduced drastically over the past decades. And we mentioned some of the causes and the risk factors. So these are the things that contribute to the decline, that drastic decline in this sperm count. And the other thing that probably I cannot mention here because of some rules or regulations, I cannot mention some of those things to you. But maybe if you ask me a question after that, I'll be able to tell some of the things that is causing a drastic decline in sperm count in men. And that is why research in fertility and sterility journal shows lifestyle factors like diet and smoking strongly impact sperm quality. So this isn't just theory, this is science fact. So this is why it matters a lot. Why I am bringing this video to your doorstep wherever you are. So understanding the differences between sperm and semen can help you access fertility. Okay, that is why I told you that some men think that just because they're able to ejaculate means they can get a woman pregnant, and that is not true. Once you understand the difference between sperm and semen, you're able to appreciate better and then assess your fertility rates as a man or as a couple. And then it also matters because it gives you better guidance and lifestyle choices. So once you know that there are certain factors and causes of low sperm count that can affect your fertility as a man, then if there are things you are doing that are not right, that's going to affect your sperm quality negatively, and you must resist from those things. That is why this understanding the difference between semen and sperm is very important. That can guide better lifestyle choices and also prevent misinformation, because there's a lot of, especially on the side of men. Again, because the ability to have an erection does not equal potency. So some men or most men think that once they're able to have a very good erectile function, it means they have very good potency, which is not so. So once you understand these two differences between sperm and semen, you're able to appreciate it better and you know and go away from stay away from those misinformation or really learn some of these things, okay? And also it helps you improve your reproductive health. So it gives you a better understanding of what to do in the way from what you should do as a couple, what you should do as a man to increase your chance of getting pregnant or increase your chance of fathering a child with a woman. So remember, knowledge is power, and especially when it comes to your body. So we come to almost to the end of our discussion on the difference between sperm and semen. And in a nutshell, we talk about the key differences between the two in terms of the the definition, the function, the composition, the fertility factor. We talk about the composition of the sperm, the head, the midpiece, and the tail. With the semen, we have, the sperm, we have proteins, water, enzymes, and fructose as well. And then we also talk about things that affect the quality of the sperm. We mentioned diet being number one, heat, lifestyle choices, environmental factors, and frequency of ejaculation. And then we also talk about the decline in sperm count over the past decades and what we need to do as men, what we need to do as couples to, rejuvenate our reproductive health as people. So this brings us to the end of our discussion. If you learned something new today, make sure you like this video and share with someone who needs it, and subscribe for more science-backed health content. And if you have any question, please drop them in the comment section below, and I'd love to help you out. Your health, your life. Check any of the videos showing right on screen. Thanks for watching.